Miss Harriet, you want to come on back? I have had the gastric bypass, and I've lost 130 total, including the 20 pounds before surgery. I still have more to go, and I'm going to get there. But I feel great. It was the best thing I've ever done for myself.
Harriet's life changed after undergoing bariatric surgery. Her health has drastically improved since her dramatic weight loss. She even stopped using a cane.
I'm able to walk, I'm able to breathe without huffing and puffing with every step. I feel wonderful. I made a new me.
Her surgeon, Dr. Victor Gonzalez. Dr. Gonzalez of the Center for Obesity Surgery is a fellowship-trained bariatric surgeon.
Here at the Center for Obesity Surgery, we offer the full spectrum of bariatric procedures, such as the laparoscopic gastric bypass, the laparoscopic adjustable gastric band, also known as the lap band. We also offer the laparoscopic sleeve gastrectomy, which is a newer procedure.
Dr. Gonzalez is one of only a handful of surgeons in the country to offer a new incisionless revisional surgery called the stoma fix.
Revision would hopefully never be required. I mean, for the most part, these procedures, whether it be the lap band, the bypass, the sleeve gastrectomy, they don't need revisions. The patients do very well with them. Occasionally, a small percentage of patients with time may need a revision. A good example would be if a patient had had a gastric bypass several years ago and had done initially very well, but then over time they noticed that the weight started to creep back. What we do is we can look at the size of the pouch. Occasionally the pouch has stretched with time. The stoma, which is the connection between the stomach and the intestine, also perhaps may have stretched with time. So with this stoma fix procedure, we can go in endoscopically, make the stomachs smaller once again, and we can also make the stoma size smaller.
So what bariatric procedure is right for you?
Patients ask me all the time, which is the best one? And honestly, in reality, there is no single best one. What I'd like to do is sit down with the patient, talk to them, and try to assess what their expectations are, what their goals are, what they're afraid of, and we try to match the procedure with the patient.
I had the procedure almost a year ago, and I've lost about 150 pounds. I went from a size 32 to a 14.
I had the procedure last year, and I've lost right at 100 pounds. I feel fantastic. I have more self-confidence in myself than I ever have, and just wake up every day happy.